Good morning, I'm Mark McIntosh.
I'm Denise Plant. Coming up on Colorado and Company, Dr. Jeffrey Kim is here to talk about the new technology in liposuction and something called liposelection.
March Madness is about to begin. All right, are we ready?
It's that time of year, and we're also grateful for the nice warm weather, but some of us not crazy about wearing bathing suits or even shorts for that matter. And men are concerned too. Diets and exercise, they just don't give you the look that you really want.
Dr. Jeffrey Kim from Colorado Aesthetic Plastic Surgery uses the latest technology to help people achieve the results they want. And Dr. Kim joins us now. Welcome back to the show.
Thank you.
How are you? Big college basketball fan yourself?
Yes, I am.
The Georgetown Hoyas, are they in it?
Yes, Georgetown is in it.
I'm
going to have to go with the Big East team this year again.
I was impressed with your basketball knowledge. That's good.
Did you know that it was 10 feet off the ground?
Yeah.
Yes, I did.
Yes. But I'm even more impressed with your knowledge of plastic surgery. So let's talk about what makes liposuction the most popular form of plastic surgery these days.
Yes, liposuction, just to give you a brief background, just last year alone, 400,000 liposuction procedures was performed. I think one of the biggest reasons why the popularity has increased in the past is, in the recent past, is because how people perceive the procedure has changed. More and more people are understanding that even after a right diet and exercise, there are just certain areas in the body they just cannot really do much about. And they're learning more and more about this liposuction procedure, which is one of the most effective and the safest procedures out there. It's an outpatient procedure, and you go home on the same day, and downtime is minimal. Yeah. So.
And the technology is amazing. There's a new liposuction technique, and it's used with an ultrasound. What's that all about?
Yes. With this new ultrasound liposuction technique, ultrasound, which is sound wave, is used to soften up, to break up everything, fat cells, before it's suctioned out. So it's very gentle to the body.
Good. Well, so that you stole the question right out of my mouth. What are the benefits? And it sounds like, you know, because you're softening that stuff up in there, possibly, there's, again, what you referred to earlier, less downtime, stuff like that as compared to the old conventional method of doing this.
Being gentle and less traumatic to the tissues directly translates into less bruising, less swelling, less pain, most importantly, less discomfort after the procedure. So recovery time has been cut down
which is
dramatically.
A huge thing for everybody.
Absolutely.
How long am I going to be out of commission?
And that's referred to as liposelection?
Liposelection is one of the terms used for ultrasonic liposuction.
Okay, there you go.
So tell me, good doctor, what's the most common place people come in and say, get rid of it?
The most common place is you refer to one of the areas, the hip and thigh regions, and also the waist area, and obviously the front tummy is very popular. And as you could see, we had the before pictures. The lady who is actually very athletic, I mean, she was on the right diet and she worked out all the time, but as you could see on the picture on the left, that she had fullness in the thigh regions and also in the waist area, and after liposuction you could see
it's dramatic.
the contour which has been reshaped on the side. So it is very effective. This is a front view of the lady with the same problem with the fullness in the waist.
Oh my.
Oh, that's big.
Right.
And like you said, sometimes there's nothing you can do. You can do all the exercise you want. You said she was athletic, but they just weren't going away.
Right.
Wow.
I think you're absolutely right.
Now something like this procedure, doctor, what kind of recovery time are we talking?
Recovery time, even with fairly large-scale liposuction, it is not uncommon for the people to go back to work in 3-4 days, 2 to 3 days. So, and as I mentioned, you go home on the same day.
So you could, in theory, you could have it done on a Friday and be back at work on Monday.
Potentially go back to work on Monday or Tuesday.
And nobody has to know that it's been done. They just are going to know a big difference.
Right.
That you look great and you look healthy. So tell me how you approach this procedure, because every doctor has a different philosophy.
Right. The way I see this procedure and the way I do it is liposuction, in my opinion, is not a weight loss procedure. It's more of a sculpting procedure. You're having this procedure done not to lose weight, but to look better. So when I do this procedure, I don't really care for flattening out certain areas, but I'm more interested in sculpting that area to make it look good. So I take my time to sculpt someone's body, and also since once again, being gentle to the body or the tissues is directly related to how much of a discomfort the patient's going to have. I try to be, and I am as gentle as possible to the tissues when I do the procedure in the operating room.
Well, I mean, obviously that's so important, as Denise is saying, because I think one of the things that maybe makes people a little hesitant is the pain involved, the downtime, etc.
Right.
And I think it's worth going back and taking a look at those before and afters again to see how dramatic it was and what you've done for these people. Here's a different angle.
Right.
Is that the same patient?
Right, same patient.
Wow. And that was her tummy region that she had to work on,
so
too.
it is very effective for the tummy also.
Wow.
Not just for the waist or the hip or thigh regions.
Because that's like for women who've had children, that's a tough spot.
Right. It is a tough spot.
Yeah.
So liposuction, once again, is one of the most effective plastic surgery procedures, and I can't say many times, it's safest.
Is that the reason? Because once you have children, sometimes not necessarily just the muscles, but the skin won't go back, so you have that loose skin, right?
Right. So actually, liposuction can be on certain occasions combined with a tummy tuck at the same time. So once again, it's being full. I mean, that doesn't really have much to do with being overeating or nothing like that. It's as we age, metabolism and the hormone secretion, they change. So the fat go to different places, and many people have a difficult time getting rid of it.
I know
even
it.
After exercising. Right.
When you come on the show, I always am impressed with this, and you're talking about it could be some liposuction, a form of liposuction done with a tummy tuck. You always have some nice combinations of procedures that can be combined that can take care of some things that might be bothering people.
Right. I do many combination works, for instance, breast augmentation and a tummy tuck combination, which can be done safely. So liposuction can also be safely combined with either breast augmentation or breast lift, as I mentioned, the tummy tuck on certain occasions. So since it is done so safely, it can be combined with other procedures.
Yeah, I wouldn't mind just moving things around a little bit. Instead of being so bottom heavy, just kind of move it up a little bit.
Okay, well, you answer. I was just saying, where would you like to have? No.
Well, get ready for summer with the look that you want with Dr. Jeffrey Kim. He really does use the latest liposuction and liposelection technology and techniques. Go ahead and give Kim's office a call. It's 303-741-3131. You can also go online to ColoradoAestheticPlasticSurgery.com. And if you mention Colorado and Company when you make your appointment, you get 10% off all of your procedure. So mention Colorado and Company. And Colorado Aesthetic Plastic Surgery paid for this segment.
All right, coming up this morning, are you ready?